Good afternoon, I'm Marina Papageorge. I'm a general surgery resident from Yale. I'm here with Dr. Nicole Geissen, who's a practicing thoracic surgeon from Rush University at the inaugural Women in Thoracic Surgery meeting, here to talk a little bit about her research regarding lung cancer screening. So Dr. Geissen, tell us a little bit about this amazing project that you presented today.
Sure. So we know two things. One is that there's a major lack of knowledge and awareness for lung cancer screening, and two, that women represent a majority of healthcare inequity. And so we decided to do a project where we kind of address both, and in doing so, use something very successful, being breast cancer screening and mammography, to parlay knowledge and awareness for lung cancer screening.
This was successfully done using sort of a very short survey for patients. I'd sort of identified if they were eligible or not for lung cancer screening, and then sort of putting them into a system where they ultimately did or did not receive a CT scan. This is sort of a hot button issue because, as we all know, lung cancer screening is sort of dismal as compared to our counterparts in breast cancer and colorectal. Correct. So leveraging sort of other screening patterns makes a lot of sense. For other institutions or individuals who maybe want to do something similar, sort of what recommendations or advice do you have for them for sort of starting a similar project?
Sure. So our program's a little different in that we don't have a centralized lung cancer screening program. We run off of more of a hybrid decentralized program, meaning that you don't go to one center and that's where we do all of our lung cancer screening. We have multiple sites throughout the Chicagoland area, which actually makes it easier for patients to get their screen, but makes the ordering and kind of coordination a little trickier. Well, a lot of these programs throughout the country have failed and haven't shown the same efficacy as centralized programs. Right. We're lucky in the fact that we have a strong group of nurse navigators that have made our decentralized program just as effective.
Excellent. And what are sort of future research directions that you hope to take the project in?
Yeah, so the big thing is that, this was kind of our first shot at this. And so we've learned a lot of things. One is that we needed more education, not only for patients, but also for providers. And the second is, how do we use the resources that we have to make this more successful? And, one of the big things is EMR systems. We use Epic, and so using, the functionality of Epic to help us out. But then also, we've really gotten a lot of traction just by word of mouth in our institution and by providers hearing about it. We did a campaign that was marketed throughout the hospital. People took onto it. We did the t-shirts and all of the things. And so with all of that, we've successfully kind of parlayed into what we were hoping for. And now we're trying to utilize the success of the initial momentum to move forward.
Wonderful. And if there's sort of one key takeaway that you hope people could take from this project, what would it be?
I think knowledge is power. And so what people don't know, they're more afraid of. It's really how you go about explaining things, highlighting the benefits more so than the risks, using, your crew and squad to help advance what you want. So we have a lot of female physicians in our institution. We kind of all banded together and said, we're going to do this for women's health, and the women physicians followed suit. And so it's kind of cool to see women banding together.
Yeah, it's amazing.
Yeah.
Thank you so much for your time.
Thank you. Yeah.